Now let's move back onto our blade skills. We're gonna categorize the body for targeting into 3 major categories: muscles, organs, and arteries. The first thing we're gonna start with is arteries. Arteries bleed very rapidly. That is why they are an essential target, especially with edged weapons. Now, edged weapons are anything with a point or a sharp edge that can puncture the skin. So a pencil would be in this category. Dedicated knife is self-explanatory. So those are the things when you're dealing with a edged weapon, you need to be very cognizant of, especially when it's coming at you. As before, we're gonna start high and work our way low. Into the head, we're gonna start with the arteries. Major arteries are your carotid. So that is going to be here onto the front half on the sides of the neck. I can attack those by thrusting into them, or I can get a very deep cut and slash into them. The next one working its way down is going to be the top of the aortic artery, which is basically just the top of your heart. I can stab downward behind the clavicle into this. So basically all of that arterial area that goes into the top of the heart. If the blade is long enough, you will be targeting the organ as well. When I move into the arms, I have the brachial. Okay, that's going to be the inside of the bicep. It starts to run into the top of the forearm as well, but I want it on the inside here. Don't have arms on Bob. Then I have the abdominal aorta. So the abdominal aorta runs right in front of your spine all the way down. So I need to penetrate the torso very deep. A bigger knife will have more effect on this. The shorter the blade, the harder it will be to get to, but I need to dig this all the way in as far as I can to try to get to the spine and cut that down. That will probably be the most difficult one to get to. The next major one is going to be your femoral. That's going to be inside of the thigh for the deep femoral. You have your upper femoral here as well. There's also an artery, I cannot remember the name of it off the top of my head, right behind the kneecap. So back of the knee is actually a good spot to target as well, especially if you end up low on their body. One of the other ones that people sometimes are not aware of is the axillary artery that's right into your armpit. So up into the armpit. Those are going to cover the major arteries that you're going to want to target if you have an edged weapon. Have a tourniquet. Now we're going to go into category number 2. We're going to call that the organs. So the majority of the organs are going to be in the torso. Starting there, what I'm going to do is I have the heart and the lung on this side. I have the lungs on this side. Behind the back, again at elbow level, I have the kidneys. I have the bladder. That's at your belt buckle. Also your intestines. If I go up diagonally this way, I have the liver. On this side diagonally, I have the spleen. I can also go directly up into the upper part of the chest. Try to stay away from the middle, so you stay away from the sternum. Center of the pectoral muscles is going to get you into the heart. Right side as you're facing your opponent, opponent's left side, unless they're opposite, which is rare, but still possibility. This side you're going into the top of the lungs. The other things, as far as organs go, I can go into the larynx, the brain. Makes everything work if I want to shut that off. The ways to get to the brain with a blade. Your shooter's triangle. So through the eyes, through the nose. The other way I can do that, underneath the chin with a long enough blade. The temple. You can get through it with the ear. You need to be upward a little bit. the back of the head, the base of the skull, and then you also have the top of the head. That's all going to be targeting the brain. The other thing that are organs that sometimes people forget about, the eyes. Those are your exposed organs. Internal puncturing is what you're going to need to target all organs. Yes, I can slash through the eyes. Most of the time I'm going to get a stab. So that is your organ targeting. Don't get cut. Okay, now we're going to talk the third and most abundant targeting with a blade, which is going to be your muscles. Muscles and tendons. Those fall under the same category. This essentially can be multifactorial. So let's break it down into two subcategories of muscles. I have the joints. So the joints are going to be at your shoulder, your elbow, your wrist, and even at the fingers. The other side of that is going to be onto the neck. So the sternocleidomastoid, which basically keeps your head upright. The other musculature that you have is what right across your abdominal, we call it the blue worm, right above your belt buckle. That is going to keep your organs inside of your torso. You have your mobility muscles. So you have the top of your thigh, you have your hamstring, and around the hip, you have your IT band. Along with the joints, you have your back of the knee, and you have your Achilles tendon. These can all be slashed, or they can be stabbed. Both are effective. When you slash them, you risk severing them. Big enough, heavy enough blade, you may dismember your assailant. A smaller blade, you may just get deep cuts with them. Really depends what you're armed with. Be aware that these also can happen to you, so you have to understand what and where you're in danger. We never target bone with a blade. It can happen, but it's usually not intentional because bones are hard and they have a tendency to get a blade stuck. So unless you have a hacking weapon, hatchet, machete, Bowie knife, kind of stay away from those. It's going to be much easier to have damage, maximum amount of damage to your assailant when you target the soft tissue of their body. One of the other things that you can do is also you can just attack anything on the face that's the skin, because it bleeds a lot. Doesn't really do a lot of damage, but because the head is so vascular, it bleeds a lot. So you can have a lot of psychological damage to your opponent just by seeing a ton of blood coming out of them. That is targeting the musculature. Go cut some steaks.